is a good day. My given name is Biat Tostaquah, and my government name is Rachel Dio. And my people come from Mayetta, Kansas, and I'm happy to be here today. Okay. So to open our presentation, I wanted to share a story on trust. There was a town out west full of farmers, merchants, and they were all engaged in trading their crops and livestock with each other. Until one day, one of these trades involved a bunch of spoiled apples. And from this one trade, skepticism grew throughout the town. And the skepticism grew beyond a point where merchants no longer trusted trading with each other. So in hopes of bringing back the sentiment of trust, the townspeople sought guidance from the town elder. Providing feedback, this town elder pointed to a tree and instructed, "Meet me at this tree and bring with you a rowing paddle, a utility belt, a spider, and all of the townspeople." And the townspeople compiled and brought all these items to the tree, and the elder then spoke. It is the tree that represents our truth, having lived long enough to witness our history and keep us connected to our roots. The row paddle represents responsiveness, our ability to properly respond to the currents of the changing river, and our ability to direct ourselves to our destination. The utility belt represents our understanding, and the belt shows the tools of culture and the way the culture goes about solving their problems. The spider represents our self-determination, our ability to weave our own environment in a manner that helps one become self-sustaining. And finally, you, the townspeople, represent our transformation, creating a better world for us and our future as a whole. So when you bring all of these elements together, can reliable and trust and quality trust flourish? So following the theme of our story, the history of Natives is rooted in the history of mistrust. Natives have endured generational trauma since the 1800s through forced relocation, kidnapping, assimilation, and government-initiated genocide. And unfortunately, this history has forced affliction and trauma also extends into the medical field. In the 1970s, through the Family Planning Service and Population Research Act, involuntary mass sterilization was coerced upon American Indian women. It had been reported that physicians sterilized about 25% of Native women of childbearing age, and there's even further evidence that suggests these numbers are much higher. And in recent cases of mass sterilization only further perpetuates the sentiment of mistrust. As recent as 2015, there has been reports of involuntary mass sterilization of Indigenous women in Canada, with open investigations now being requested from members of the Canadian Parliament. So while we could sit here and list off all the barriers that exist between Native populations' access to equitable healthcare, it's evident why mistrust can be considered the core barrier at hand. In 2011, a study was conducted on patient-provider interaction with Native patients, and the findings show that trust emerged as the central theme in the determination of whether an interaction is considered good or bad. But simply acknowledging mistrust as a barrier, it isn't enough when our goal is to successfully connect and craft communication efforts with the Native population. So instead the central focus needs to be on how we can properly approach this barrier through strategic, culturally appropriate planning. All right, so in a 2011 NIH published study, a collaborative comprised of several providers, community members, youth, university faculty, and behavioral health organizations, they formed a group titled Project Trust, and from there they created the trust model. The group took each letter of the word trust and expanded upon it by applying culturally relevant definitions to each letter. So we got first the T for truth, truths about historical trauma and the current inequities that impact the mental health and well-being of Native individuals and their families. R is for responsiveness, to issues and needs identified by Natives and their families from their perspective. U is for understanding the effectiveness of traditional Indigenous healing practices and cultural teachings. S is for self-determination of youth and families to guide their behavioral self-services. And finally, T for transformation of individual families, communities, systems of care, and social structures. And throughout this presentation, we will showcase how the truth model is applied in real life communication efforts and how you too can apply it into your own initiatives. So who exactly are trusted messengers? At times, a trusted messenger can be found through individual representatives like a family member or a peer or a healthcare provider, maybe even any kind of figurehead such as a political leader, CEO, or a media influencer. And then we have group representatives such as a school or a community at large that can also be considered a trusted messenger. In today's world, a lot of the messages and outreach is conducted via social media. In 2017, there was a study that collected and characterized over 11,000 tweets generated and shared by Native American advocates active on Twitter. And it was revealed that the 3 of the top 5 topics that garnered the largest number of supporters involved hashtags referring to issues of life or death for Native Americans. And this reflects how core truths play a prominent role in messaging. So with topics related to life and death as the top trending conversation, Native messengers on social media platforms are very vocal, encouraging responsiveness to issues and the needs that can be identified by the Native population or the audience. And these are usually verbalized as call to actions. Native social media influencers also carry out the values of understanding. And an example of a social influencer is Che Jim from the Navajo tribe. He has millions of TikTok subscribers, including myself, and he creates content that is culturally relatable to his audience while taking liberties outside of social media to also share his cultural understanding by speaking at events or through thought pieces like during interviews. Early in 2022, he was featured in a Newsweek article in response to an Indiana high school's caricature portrayal of Native ceremonies. And due to there basically being no barrier entry when it comes to the internet, social media allows users to chime in on the conversation and to curate space and communities that they can relate to. And a 2020 study titled Social Media Use is Positively Associated with Health, Nutrition Behaviors in Native American Adults showcases how social media can successfully lead to positive transformations. Greater frequency of social media use to share health-related goals, successes, or challenges was associated with a decreased intake in sugar-sweetened soft drinks and increased intake in vegetables, fruit, and water. So in a webinar we held in November of 2022, Susan Levy from the UIO Native Health, she shared how they incorporated social media influencer Alana Yazzie as a trusted representative to connect their healthcare campaign to a larger Native audience. And here is a clip from that presentation.
So one thing we've tried hiring an influencer, and this is Alana Yazzie. She is the Fancy Navajo, and she's got quite a following in Arizona and the Southwest. Alana Yazzie is amazing to work with. So she had done some things for us. We had done some COVID vaccines a couple years ago. We had also hired some Native American comedians to do videos on the importance of vaccines, COVID vaccines, and all of those were very successful. And this is Alana Yazzie, most recently about getting out the Native vote. Sorry, I couldn't find my other photos. And we just had her do 2 videos for us to get out the Native vote. and these were really good as well.
Hi everyone, it's Olana here with the Fancy Navajo. Just wanted to remind you at noon today on the Native Health's Facebook page, I'm going to be showing you guys how to make my fancy blue corn cupcakes, so don't miss out. Bye!
All right, thank you. I hope you guys enjoyed that little clip. In times when we are uncertain or untrusting, hearing from familiar presence, someone who looks like us or at least has experience or interest similar to ours, increases the likelihood of us accepting a particular message. This form of familiarity has been assessed in political representation, which can also be defined as descriptive representation. In a study titled Representative Voices, Native American Representation, Political Power, and COVID-19 in U.S. States, a correlation was discovered between Native political representation and COVID-19 cases. Descriptive representation theory was applied to assess how the presence of Native American legislators reduced COVID-19, and the results show that where Native American representation and Native American political power in state politics were greater, COVID-19 cases on the tribal lands were fewer. Native American representatives were responsible for disseminating important public health information on the COVID-19 pandemic to their constituents and Native communities. And this dissemination of information fits under the truth model value of truths, the truths about historical trauma and the current inequities. And during a panel hosted by the Washington Post, Native leader in Kansas, Rep. Sharice David, expands on the truths in the following quote. The disproportionate impact of the coronavirus pandemic have to do with consistent underfunding of the IHS or investments in infrastructure in Indian country, investments and funding for urban Indian health centers. And Congresswoman Deb Haaland, co-chair of the Congressional Native American Caucus, has also shared truths to a national audience with her title, The Federal Government Fiddles as COVID-19 Ravages Native Americans. And during the early days of the pandemic, Native representatives initiated the proper responsiveness and engaging communication efforts with their constituents and coordinated responses from both federal and local government. A great example includes representative leadership in New Mexico from the Pueblo, Apache, and the Navajo nations, coordinating early with states for testing, case tracking, tribal border closings, and demand for federal response. And of course, through policy, our Native American representatives bring about needed transformation. In a recent passed advanced appropriation bill for IHS, which includes IHS receiving more than $9 billion in COVID-19 relief funding, Native representatives such as Rep. Sharice David is also responsible for helping this bill get passed. And so far, we have covered the impact of individual representation as trusted messengers. But how can we apply all of this specifically to an urban setting? There are unique barriers to establishing targeted messaging to American Indians and Alaska Natives that live in urban locations. One is the fact that numerous federal definitions of what constitutes an AN community and tribal nations typically do not include this larger segment of AIAN people, while other barriers are the decreased opportunities to access cultural events and health promoting activities. All right, so introducing, and I hope I'm saying this right, the Takona Project, a collaborative between prevention practitioners, an urban Indian wellness center, and an elderly advisory board comprised of American Indian elders from the local community. And this project utilizes community-based research participation to assess substance abuse among the urban Native teens and young adults with the goal of establishing successful prevention tactics. And through their efforts, the Takona Project also published several publications on drug prevention in addition to communication campaigns. All All right, so social connection also plays a pivotal role in Native culture. And in one of their publications, the member of the Tacona project shared empirical research documenting how social support affects behavioral health. And the research also shows that social support effectiveness was shown to be a protective against mental health problems, and how social support was positively associated with resilience among American Indians and Alaska Native adolescents. And the lead prevention practitioners on the team come from thorough backgrounds of Native healthcare and understand the truth regarding Native culture and history. So principal investigator Daniel Dickerson is an Alaska Native that has worked in Native American communities for many years. Also, Dr. Carrie Johnson from Wahpeton, Dakota. She's head of the nonprofit Sacred Path Indigenous Wellness Center. And she has worked with local, county-wide, statewide advisory boards to increase the access to cultural competence of services provided to Native Americans. In the first year of this project, it was spent mostly working with several communities just to understand the challenges, the needs of the community related to substance abuse. And by gathering this intel, we can properly know how to respond. What really defined the success of the Tacona project was their integration of culturally based wellness methods, successfully fulfilling the understanding value in the trust model, understanding the effectiveness of traditional Indigenous healing practices and cultural teachings. In their publicized study on opioid and drug prevention among Native youth, 370 participants were randomized into different workshops that offered culturally appropriate interventions, which included drum-assisted recovery therapy, a Native American health sleep program, as well as wellness circles. I've also heard of equine therapy being a huge thing. They also established an elder advisory board made up of key American Indian and Alaska Native community leaders who were revered as keepers of knowledge. And finally, the value of self-determination, which involves having youth and family be proactive in their own behavioral health service and also incorporated throughout the program. The team conducted 13 focus groups with emerging adults and the parents and emerging adults to address how to discuss opioid use, alcohol, and cannabis among their social networks and social connections within their urban communities. So no matter the messenger, trust can only be built over time. And making concerted plans focused on connecting with your audience will contribute to true quality relationships that will eventually spill over into making new connections. Miigwech, thanks you guys. Thanks for your time. I appreciate it.
Thank you so much, Rachel. Now we'll be going into the second half of our presentation, which focuses on utilizing data and vaccine messaging. So speaking on this section is Nakui statistician Alec Samo. So Alec graduated from American University with Masters in Statistics in 2015, and he joined the National Council for Urban Indian Health in 2020 as part of the Research and Public Health Division. In his role, he has tracked COVID-19 pandemic in UIO service areas, analyzed the most recent census data, published data tools on Nakui's research blog, and analyzed feedback from Nakui webinars, communities of learnings, and events to improve our technical assistance activities. So with that, I will pass it to Alec. Alec?
Thank you very much for attending. As stated before, my name is Alexander Zamo, a statistician here in Nakui's Research and Public Health Division, and this is a brief overview as to how best to use data to inform your messaging about the COVID-19 vaccine to your patients. This presentation will start with an overview as to why it is important for patients to have trusted messengers of vaccine information. messengers-like providers at UIOs. We will then move to explore the many resources messengers can rely on to inform them, including reference materials and reports, and your facility's own data leveraged through EHR and dashboards. Lastly, we will talk about resources around translating scientific manuscripts and trials. First, we want to impress that research shows that Native people are strongly requesting understandable messages about vaccines tailored to them and their communities, spoken by familiar and personal partners. A great example of these sorts of tailored messages was the #BeAGoodRelative campaign. Last year, in 2022, Nikui released a series of 4 animations across our social media platforms with collaborations from Next Day Animations, with the goal of providing readily accessible and easily viewable messages about COVID-19 and other routine vaccinations. Nikui shared these videos to be an example of tailored, culturally competent vaccination messaging that could be utilized by providers to help them spread the word and hopefully reach more people in the AIN community. These animations were designed so AIN people could feel that the messages were made for their community. And indeed, our analysis of the campaign bears this out. Based on survey results from viewers of these animations, 48.8% of AIN viewers strongly agreed that these videos were tailor-made for their community, and 57.1% of providers who serve AIN communities strongly agreed that these videos were tailor-made for the communities they serve. Additionally, we asked viewers what factors is of greatest concern when deciding to get vaccinated. After coding free text responses into keywords, we found that the most important concerns were for gaining protection from the virus and the safety of the vaccine. Other top concerns include knowing about the side effects, protecting family and community, stopping the pandemic, and concern for perceived harm done to the body from the vaccine. Findings from our research were corroborated by many others, enforcing the importance of these types of messages to Native people that Native people respond to, and the sources of these messages. In a recently published manuscript in Vaccine X, researchers interviewed a sample of urban Native people in Los Angeles. The sample indicated the desire for the messages made specifically for them and united leadership from tribal and community leaders to relay those messages. Respondents were asked what were the strongest reasons to get vaccinated and what were the strongest reasons to not get vaccinated. Similar to the findings from the #BeAGoodRelative campaign survey, the most common reason for why respondents would get vaccinated was to keep their families and communities safe, while the most common reason why they wouldn't get vaccinated was concerns for side effects and the safety of the vaccine. In 2021, there was a large national survey of 13,000 people surveying their beliefs and behaviors around vaccinations. This survey was done by the African American Research Collaborative and the Commonwealth Foundation, with collaboration with First Nations Development Initiative. The surveyors oversampled AIN respondents, resulting in 1,900 AIN people being represented in this survey. AIN respondents indicated that healthcare providers, personal care providers, family, and tribal leaders were considered the most trusted and convincing messengers in the campaign to get vaccinated. Among unvaccinated AIN respondents, messages about protecting family and illustrating the burden of the pandemic on Native communities was indicated to be the most effective. Additionally, they indicated that the biggest concern about the vaccine included the safety of the vaccine and its rush development. Also in 2021, the Urban Indian Health Institute conducted a survey of urban Native people, the Strengthening Vaccine Efforts in Indian Country project. Their findings corroborated the findings of other research and our own #BeAGoodRelative campaign results, namely that the sample of urban AIN people wanted to see transparent and contextually tailored messages around scientific information about the vaccines, and that healthcare providers and community leaders were the most effective ambassadors for vaccine messaging as compared to distant institutional public health authorities. As trusted messengers, it is important to have reference data on hand about the state and severity of the pandemic, and its impact in urban and communities, and information about the vaccines. Familiarity with statistics about the conditions in your area and across the country is important as the foundation of the message around the importance of the vaccine. NCUI is here to help, providing tools that serve as data resources to inform UIO providers as to the pandemic, vaccines, hesitancy, and behavior. And there are a wealth of external data sources, many of which are used in NCUI's COVID and vaccine reports for additional information. First, NCUI created the Report on Adult Vaccine Equity for Natives, also known as the RAVEN. This was a periodic report on vaccine and vaccination data in UIO service areas from public sources such as the CDC and Johns Hopkins University Coronavirus Resource Center. This report also includes a scan of news and published articles relevant to vaccinations within the urban AIN population. This report was published monthly from September 2021 to February 2022, though new RAVENs will be published in 2023. These reports can serve as a useful reference for UIOs to get COVID-19 and COVID-19 vaccination data and can be found on our Knowledge Resource Center. The Knowledge Resource Center, or KRC, is an archive of news, resources, and manuscripts hosted on NCUI's website. The link to the KRC will be posted in the chat. Providers from UIOs are invited to use the KRC to search for information on all manners of topics, including COVID-19. NCUI posts new submissions to the KRC at least every 2 weeks, and the KRC is where you can find previous RAVENs, and NCUI will be looking into new products such as article review one-pagers. NCUI is also planning on publishing a new monthly periodic COVID-19 report summarizing and compiling statistics and data on COVID-19 tracking, cases, impact, and vaccination in urban AIN populations. This is planned for 2023 and will be posted to the KRC along with the RAVEN. Resources such as the RAVEN and the upcoming COVID-19 report can be very helpful starting points for reference information summarizing the data and news in concise takeaways and providing tables and graphics on cases, deaths, and vaccinations related to urban AIN populations and UIO service areas. Additionally, there are many sources of information providers and trusted messengers should check out for themselves, many of them including their own resources that can be useful for information, data, and messaging as well. First, there is the CDC, whose website is full of data and resources on the pandemic updated daily. Perhaps the most useful starting resource on the CDC's website is the COVID-19 Weekly Review. This publication is a narrative interpretation of the most up-to-date news and statistics related to the COVID-19 pandemic. This includes visualizations and infographics on all matter of COVID-19 related subjects, including cases, community infection level, vaccination, hospitalizations, and treatments. This review also links with other data sources on the CDC page, such as COVID-19 Data Tracker, for more detailed and historic information. Additionally, this report also highlights recent news and published manuscripts. Further, providers can subscribe to the weekly report to receive it as soon as it is available. The COVID-19 Data Tracker is a very rich resource of general COVID-19 data. This page offers many statistics, tables, and visualizations on all the COVID-19 statistics explored in the weekly review, and then some. Additionally, on the COVID-19 Data Tracker, there's a link to the integrated county view, which provides greater information at the county level, including graphics and maps. The data tracker also includes up-to-date health equity information, including trends in vaccination, cases and deaths by racial group and by urbanicity. Additionally, the CDC provides an explanation and discussion about vulnerability indicators or measures at a population level that make a given geography less resilient to disasters such as a pandemic. NCUI published an analysis on its research blog showing that within UIO service areas, AIAN people tend to live in areas of lower resilience and greater vulnerability. Check out our post on the research blog's interactive data for an interactive data tool illustrating that association. The CDC provides a number of guides on its website to help understand its own resources. These include videos and PowerPoints explaining the COVID-19 community levels as shown in the weekly review. They also include a guide suggesting how providers can tailor vaccine information to their patients. One such guide includes motivational interviewing, stressing the empathetic and collaborative approach to discussing vaccines with patients, suggesting that messengers should help the patient guide themselves to greater acceptance of vaccines. Further, following up on their strengthening vaccines in Indian country survey mentioned earlier, researchers at UIHI took that knowledge and combined it with follow-up focus group interviews to compile a list of recommendations as to how to talk about vaccines to patients. They published this as the COVID-19 Vaccination Messaging Guide. Their guide summarized by a number of main points, which are similar to the CDC's recommendations for vaccine messaging. Based on their survey findings, messengers might want to lead with positivity, centered around the community, and to highlight the need for a comprehensive approach when dealing with the virus. UIHI also suggests acknowledging but not leading with anxieties around the virus. This is similar to the CDC's suggestion that messengers should appeal to the values that most resonate with the audience, underscoring the need for personalized messengers who are trusted by patients and their communities and are personally familiar with their beliefs and outlooks and struggles. Viewers are highly encouraged to read the guide for more data and rationale for all of their insights. Additionally, providers should also consider UIHI's vaccine fact sheets, one-page handouts that can be very helpful conveying vaccine information to your patients. And lastly, UIHI also has the COVID-19 data dashboard, where UIO providers can view data about COVID-19 cases, deaths, and hospitalizations among AIN people in urban areas, forming an additional reference dataset as their foundation when understanding and conveying the pandemic's impact to their patients. And lastly, there is the Johns Hopkins University Coronavirus Resource Center. The JHU CRC includes information more generally about the COVID-19 pandemic, including an interactive US map showing statistics about the COVID-19 pandemic at a county level. The Coronavirus Resource Center also includes updated reports about the trends of the pandemic in each state, the race to full vaccination by state, and many other resources. Over and above public data, which is still an important foundation for information for providers and their facilities, your facility can harness its own data to inform itself on COVID and the vaccine in its own community. To this end, NCUE is holding an extensive training and webinar series on health information technology and electronic health records support. There will be 10 trainings and webinars talking about the challenges of HIT and EHR implementation, 3 of which have already occurred. The most recent training, How Data Can Work Right for Your UIO, was held on December 15th, 2022. This training went into a great explanation as to how organizations can use and leverage dashboards to learn and engage with their own data. Please check out NCUE's YouTube to view previous sessions. Our next HIT EHR series webinar will be held next week on January 19th, where there will be an encore presentation of this training. As was explained in this most recent HIT training, dashboards can be an excellent way to help get information on your own data. However, each facility's dashboard can be quite different depending on the EHR they use and the data they have available in it. UIOs can request one-on-one assistance to help them with implementation of EHR, as well as training and TA for building a dashboard, or you can use the data request form that was also mentioned earlier in this presentation. As mentioned in the first section, urban AAN people want messages about the science and trial evidence related to safety and efficacy of vaccines. However, publications might require a degree of translation. Publications on efficacy and safety are shared on the CDC's website or found on searches on PubMed. Including new publications are often highlighted in resources previously mentioned, such as the CDC Weekly Review, or NCUI's Raven, or the upcoming COVID-19 report that NCUI will be publishing. Equally, manuscripts relevant to urban AAN populations or UIO service areas will be posted to the NCUI KRC as researchers here find them. To aid in understanding of these manuscripts, the Research and Public Health Division will start developing article review one-pagers and posting them to the KRC, supplementing and complementing these manuscripts. These reviews can serve as resources aiding providers in understanding and navigating all the scientific manuscripts so they can be better informed and relay their knowledge in their own words and experience. After reading these reviews, readers can then continue to the manuscript for more details, which will be linked or the location provided within these one-pagers. UIOs or providers at UIOs can lean on us to help them with understanding manuscripts if needed or desired by simply letting us know with a data request form, as you see here. To bring this all together, you are a trusted messenger for vaccine information. You are a provider who knows the community and who knows the people and their background. And you are the best person to be able to relay all that information about COVID-19 in a manner that is understandable and relatable to urban AAN people. Therefore, by arming yourself with background information data about the pandemic and the vaccines, combined with data from your own facility, understanding the most recent news and science, and messaging tools such as guides and infographics summarizing and digesting data and published science, you will have an informed, data-rich, yet understandable message. Delivered by a trusted messenger, we hope that we can reach and strengthen the urban AAN community, guiding them to more vaccine acceptance. I would like to hand it back to the host, Tiffany.
Thanks so much, Alec. So at this time, we want to see if there are any questions for either Rachel or Alec, now that we have seen their presentations, and just want to see if there's any ideas, questions, comments at this time. And no worries, if there aren't any currently, you could take a couple minutes to think of some if you would like, and put it in the chat box. And then I know Micah had a couple questions to help get the conversation going. So I'll pass it to Micah.
Thank you. Yes, we did come up with some questions to kind of help get everybody's brains going. So one of the questions that we had was for Rachel. And what is a good way to establish your UIO or specific provider as a trusted messenger within their community?
I think if we can, a lot of it is just it's just showing up, just being present and doing things like what we're doing now is spreading information best way you can.
Thank you. Do you have any social media trainings that you would recommend to help UIOs improve their engagement, or anything that you might be able to share to help increase that awareness and reach?
Absolutely. Like I said earlier, social media seems to be the best way to reach people. I believe like our social media influencers too are increasing. And so I encourage people to go check out platforms like Well for Culture. That's a wellness program and a model, 7 circles of wellness that they have created. And, you know, it kind of goes back to that comment that in our presentation about people choosing to drink less soda and eat better foods, because we've got role models now that are out there and we can see them through our social media. And I know they specifically work with the Health Wellness Institute, I believe, and they also work on their own. They've come to my community. I've seen them through their social media go across everybody's community, and so they are definitely a good resource for building that trust.
Thank you. And then this next question, we do have a question in the chat, so we'll pop there. Do you think influencers are still a vital resource for other minorities of color as well? It seems to be diminishing among other folks, for example, Latinos.
Can you repeat that one more time?
Yes. Do you think that influencers are still a vital resource for other minorities of color as well? It seems to be diminishing among folks such as the Latino population.
I feel like I focused a lot on Native American. I'm not sure that I have seen like a lot of like Afro-Indigenous folks come about. I do feel like specifically you mentioned the Latino, I don't see very much of influencers through that category. I'm not really sure how to Alex, do you have any?
I don't have much background with influencers or social media, unfortunately. If anyone else in this group has perhaps something has some experience with that, they're more than welcome to share, though.
Yes, please feel free to come off mute, and either you can answer this question or ask one of your own. No worries. Alec, we did have a question for you. What is a good way to identify a trusted source?
That's a very good question. So I wanted to quote Dr. Ilan Shapiro from the Department of Health and Human Services, that facts are not true because they come from a particular source. Facts are true because they are supported by the evidence. Now, his message was with regards to that sources like the CDC or like the college or a number of medical professional colleges. They would have we have as professionals, we have a trust that we have that they are trustworthy because of their past and their history, but they also show their data. I think that one of the easiest way to determine trustworthiness of a source is how clear they are and how upfront they are about their sources, their evidence. Sources such as the CDC or these colleges, they will present citations. They'll present the links to the science that backs up the claims and their recommendations that they make. And if you're looking for sources alternate sources, in addition to these professional sources, I would look and evaluate, well, how clear is their backup, their evidence to it? Are they being upfront with? Are they sharing their resources to how they got to their recommendations? And if they have links to their scientific reviews or their manuscripts that they're resourcing, Do they provide graphics from those resources, or do they present tables or statistics? Because the more information and the more detailed information they show, to me is a signal that that they should be trusted more with their message, because as opposed to just giving a claim. To quote an engineer, actually, Edward Demings, without data, you're just another person with an opinion. So I would look for people who make sources whose recommendations are backed up with clear, specific data, with the sources of those data, and often an understanding of what that data says.
Thank you. That is a great answer. I have one more question. Where do you recommend UIOs or anyone interested go to find peer-reviewed articles?
Well, certainly. As I might have mentioned, so it's specifically about COVID-19 vaccines. I would look at, or COVID-19 as COVID-19 data. I'd probably go to the CDC weekly review. They go through reviews of manuscripts and the most recent science. So I would probably use that as a starting point. For UIO service, for UIOs and urban AIN communities, I'd probably look into our KRC, where we continually look for some news or manuscripts for the most recent that is relevant to our facilities and our communities, that I think that would probably be one of the best ways to find it. And again, as I was mentioning, the Research and Public Health Division will be starting to look into having article review one-pagers to facilitate understanding of the manuscripts that we'll be sharing on the NCUE KRC.
And thank you for that. Are there any other questions that anyone else has thought of? If not, I'll pass it back to Tiffany.
Thanks, everyone. So thank you, Alec and Rachel, for your responses to those questions. Very helpful. And so now we, with the closeout, just reviewing some upcoming events that are on the horizon. I know the slide has been up there, but just to reiterate quickly. So we do have quite a few events left for January. On the 18th, we have a CDC STI information and recruitment session. On the 19th, it's not listed on this slide, but on the 19th, we have that encore presentation for HIT, how data can work right for your UIO. On the 24th, the CDC IPC Community of Learning, their first session. The 26th, the Get Out the Vote /IVE National Webinar. And on the 31st, NCUE's 2023 Urban Indian Health Policy Priorities Preview. And looking forward to February, we have on the 1st, the 4-in-1 Peer-to-Peer Solutions Center. And on the 7th, we have a virtual dialogue on maternal mortality review committees. Some current funding opportunities. So we do have the electronic case reporting, or ECR, UIO subgrant award for year 2. That is still open. So 3 UIOs will be awarded up to $84,600 each. Applications are on a rolling basis. And then emergency preparedness and vaccination planning storyteller application, that is still open, and UIOs will be awarded up to $30,000 each. And lastly, as mentioned earlier in the presentation, we do value your feedback. It definitely helps us better support your UIOs with technical assistance. So please take the evaluation survey. The QR is on the screen, as well as the link, and the link will be put into the chat box as well. And we'll leave that on for the rest of the session, so you have time to take that or have any other questions for the session or even the survey. And again, thank you so much for your time and your attendance. We truly value your feedback, and also a big thank you to our presenters, both Alec and Rachel. So thank you everyone. Have a great day, and we'll see you next time.